Hi, I'm Carol Rowsemitt, nurse practitioner. My job is to help you lose weight and keep it off. For over 10 years, I've specialized in weight management and thyroid disorders. I come from a different perspective than most healthcare providers. I have a bachelor's degree in chemistry and a PhD in biology. I spent 20 years as a research science and educator before I switched into nursing. My experience as a scientist has proven to be very helpful in my current work in weight management. I worked with Dr. Thomas Najarian for 7 years in his weight loss clinic in Los Osos, and I learned a lot from him. He put together a combination of 2 medications to help suppress appetite. He used Famine, which has been out there for years. It's a stimulant. He used low doses of it, and he combined it with topiramate, a medication designed for seizures, also approved for migraine headaches now. And by using the 2 medications together, there's a principle involved here. If you use 2 medications for whatever you're doing, if you use 2 medications that work in different ways, you can use lower doses and get more effectiveness and fewer side effects. And that's what he found when he put the combination together. In the past few years, there's been some good news for people trying to lose weight. Number one, the FDA has approved 3 new drugs. One of them actually is the combination that Dr. Najarian put together, called Rowsemitt. In addition to that, both the American Medical Association and Medicare have come out with statements that this is a chronic condition. Chronic meaning long-lasting. So obesity is a chronic disease. Unfortunately, most people who have never gained weight really don't understand how different the body is once you're carrying the extra weight around. Many people, possibly even your physician or other healthcare provider, believe you should just eat less, exercise more, use your willpower, and that'll do it. Unfortunately, that has about a 95% failure rate. What is it that your physician or other provider recommends with a 5% success rate? Nothing. But they don't realize, they just don't understand, they don't know those statistics, and they don't understand the problem. So just why is it so hard to lose weight and keep it off? It turns out that once you've gained the weight, your primitive body fights to maintain it and to prevent you from losing weight. This is called the famine response. Now, sure, there are times people went through famine in primitive times. So we're not really talking about famine. I'm not talking about a diet where you eat 200 calories a day. But we're still stuck with that term, the famine response. But if you picture that this is what our bodies are really designed to do. As recently as 100 to 200 years ago, it was hard to get enough food. You never knew where your next meal was coming from. Surviving famine was really important. Nobody was trying to lose weight. So what's the famine response really all about? The studies are done before and after a 10% weight loss. So if you started at 200 pounds and now you're at 180 pounds, they're going to study the before and after there. And you find 2 types of adaptations. The first is an increase in interest in food, and the second is a decrease in metabolism. 2 things working together to try and maintain your weight. And what exactly does the published science tell us? Let's look at the interest in food first. There are hormonal changes in your stomach and intestines that send signals up to your brain that say you need to eat more, you need to be more interested in food, you need to be hungry, and it's going to take you more food to feel full. So the brain gets excited about this in many, many pathways. And when you're seeing interesting food, one of the pathways involved is that of the opioid drugs. So the drugs such as heroin, morphine, the addictive drugs go through this pathway as well. Well, we didn't evolve this pathway for heroin. We probably evolved it for food. So if you know somebody, or if you yourself say, gee, I swear I'm addicted to sugar, there may be some truth to that. So that's one half of it. The second part of it is the decrease in metabolism. And this part, for me, is particularly intriguing. What we see is a decrease in the active thyroid hormone. What's really unfortunate is that does not show up in the standard testing that we were all taught to do to look for changes in thyroid. We were taught to use thyroid-stimulating hormone, just that one hormone, to determine whether or not your thyroid was functioning well. Well, it turns out that there isn't any dramatic change in thyroid-stimulating hormone when you go through this dip, when you go into the famine response. You can be at the bottom of that famine response, as close to hibernation as a human can get, and your TSH is going to look just fine. So your provider who has run TSH is going to misinterpret that information because they're not looking at the rest of the hormones involved. And they're going to say, everything's fine, you're probably eating more than you think you are, so eat less and get more exercise. I've heard that from so many patients. Dr. Najarian and I have even published a couple of papers on this to try and get the word out. And it's frustrating that it's not well understood because it stops a lot of people's attempts at losing weight. And it's not just the active thyroid hormone dipping. The machinery inside the cell gears down too. So whatever thyroid hormone gets into the cell can't do its work as much. So the really sad point is not only do you burn fewer calories at rest, and this has been known for a long time that you burn fewer calories at rest when you're in the famine response, but you also burn fewer calories when you're active. So if you picture that person who's down to 180, has lost 20 pounds, they're at the gym, working out, pumping weight, the person next to them can be pumping the same amount of weight. If they weigh 180 pounds, and that's always been their weight, they're not weight reduced, that person burns more calories when they're pushing weight than our patient who's lost 10% of their body weight. So that sure doesn't seem fair, but it's part of that adaptation when the metabolism dips. How will you know if your metabolism dips? You'll probably feel it. The most common symptoms are being cold and tired. Well, being tired can be caused by a heck of a lot of other things, so that's not really very diagnostic. But being cold is particularly interesting. You can be cold all over, but very commonly it's just hands and feet. So I'm always asking questions about this at every follow-up visit. Not just hands and feet, though. Pay attention to whether your nose is cold, whether your buttocks, more commonly known as your butt, whether your buttocks is cold. And interestingly, even though you may feel very cold, you don't shiver because your primitive brain wants you that cold. For some people, their basal body temperature drops. If they take their temperature, they can be 97 point something instead of 98.6. Other symptoms, common low thyroid symptoms, are depression, constipation, hair loss, and dry skin. These are just the typical ones. So when you go into this aspect of the famine response and you find you're cold and tired and you're being less active, then what happens is you typically hit a plateau. Is this starting to sound familiar? You diet for a while, you lose some weight, you hit a plateau, you struggle, you keep trying, and then finally you give up and you eat more. For me, it was always a banana split. Is this a character flaw? Lack of willpower? No. It's your primitive body really working hard to fight for survival. Well, none of this was in the textbooks when I taught human physiology 25 years ago to pre-meds and pre-nurses. The general medical community is still not aware of this, and I doubt it's being taught in med schools or nursing schools today. So while people have heard of the famine response, most providers aren't really aware of how powerful it can be. Not everybody goes into the famine response. So sure, there are some people who can lose weight and keep it off. And unfortunately, that gives the rest of us a bad name because, well, if she could do it or he could do it, why can't you? Is the famine response the only thing that's fighting you when you're trying to lose weight? Of course not. There are other things involved. Habits, cultural traditions, stress. Stress at work, stress at home. That's one of the biggest challenges I see that people have. And we have to address those issues as well. It's not just me saying, here, take these pills, go out there and lose weight. Also, I want you to think about the difference in our lives today. You may not even be aware of this. You think back to primitive times, yeah, you know our ancestors didn't have enough food around. But what you may not realize is the amount of food we have available to us today is absurd by standards of any animal, any human in an earlier culture. And it's not just the food we have at home. It's not just the advertising we see on TV that makes us interested in more food, that it's always being put in front of us. You go to the hardware store, you go buy office supplies, you go to the gas store, they all are selling food. None of these places sold food 50 years ago. So there's a lot stacked against you now in terms of cues saying eat, 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 that society never had before. So my goal is to help you with all of this. Some people can control their appetite and struggle only with the low metabolism part of it. Other people are just the opposite. They need help with their appetite, but their metabolism never dips. I can't tell you why some people are one way and some are the others, but I know it to be true. So when needed, I use a variety of medications to suppress appetite and, if necessary, medications to get you back to normal metabolism. And I'm a real Goldilocks person on the metabolism. I don't want you too low and I don't want you too high. I want you just right. No symptoms of low thyroid, no symptoms of high thyroid. You should feel normal. This combination can help you lose weight and keep it off. During your first visit, we're going to be looking at your health history. I'm going to do a physical and order some lab tests. And you and I are going to sit down together and consider the available options. We're going to talk about medications, diet, exercise. In terms of medications, I follow the same philosophy that Dr. Nigerian believes in, and that is generally 2 appetite suppressants. We'll start with 2 of them that work by different pathways. So you get, again, you get more power, less in the way of side effects, because you're using lower doses. We'll choose medications for you to start with, and I'll explain the possible side effects. As far as dietary plan goes, I do not hand you some list that says this is what you eat, this is what you don't eat. We talk about what you've done in the past, what you've had success with in the past, how you like to eat. Some people do Atkins. Some people do Weight Watchers. Those are kind of opposite extremes. Some people eat breakfast. Some people never eat breakfast. That's fine. But if your weight is mainly around the middle, we're going to have a talk about the value of low-carb eating. For exercise options, it may surprise you, but the data shows that exercise, while it helps somewhat, it is not the main cause of weight loss in most people. So I want you to do something for moderate exercise, but I'm not the one who's going to insist that you're at the gym 2 hours a day. If you love that, fine. Follow-ups tend to be every 6 weeks. We'll see how you're doing, work out what changes might need to be made, and that goes on until you get to your goal. So what happens when you get to your goal? Remember that 10% weight loss graph? Here it is again. The scientific studies show the bad news, that 1 year after weight loss, the famine response is still present. This is a chronic, long-lasting problem. So people who have excess weight and lose it may always face this as a challenge. I do have a plan for maintenance. If you are interested in continuing the medications, you go to lower doses of the medications, come in every 3 or 4 months, and we will continue to tweak things as needed. If you want to try this without medication, it works for some people because they, for whatever reasons, either their famine response wasn't so bad, who knows, whatever, but some people are going to be able to do it by themselves. I do find people who come back to me a year or 2 later and say, well, I kept it off for 6 months or 3 months or a year, and then life got challenging, so I put some weight back on. I'm not going to laugh at you for that. I'd be happy to see you again and help you. I understand that there are many, many variables going on here, and you have to play this the way it works for you. Of course, this brings up another question. Am I going to take medications for the rest of my life to keep this weight off? Think about other chronic diseases. Now that you're thinking about this as a chronic problem, think about high blood pressure, diabetes, things like arthritis pain. If you have something like high blood pressure and you get treated and they change the meds and they have to juggle it and then they get the meds right and now your blood pressure is very well controlled, do you go back for your next visit and have them say, oh, okay, we fixed it, let's stop the meds now? Of course not. If you're recognizing that obesity is a chronic condition, then you start to see why it makes sense to use some level of meds, probably forever. So I hope I've helped you understand the forces that make it hard to lose weight and keep it off, as well as ways in which I can help you do that. If you're scheduled to start my program, welcome. If you're simply watching this on my website because you're interested in hearing more about what I do, but you're not sure and you want to ask me some questions, please leave a message for me on that contact page and make sure you leave a phone number. Thank you, and I look forward to meeting you.